My name is Dana Arnon. Believe it or not, I once dreamed of a career in fashion journalism, but life had other plans. I became a registered nurse and eventually the owner of a home health care agency in Long Island, New York. Now, I'll be honest, some days are hectic and sometimes I just want to scream, but my mission and my passion is what keeps me going, helping seniors navigate the chaos of aging in today's world. Every day I see the challenges our seniors face, and it drives me to fight for change, because no one deserves to face the end of life alone. After all, sooner or later, we will all be seniors. So come join me on this journey where we tackle the tough questions, uncover the truth, and fight for the dignity, fairness, and justice for our aging community. Welcome to Senior Care Matters. Welcome to Senior Care Matters. I'm Dana Arnon. Today we're talking about something many families hesitate to discuss: hospice care. What is it? When is it the right time? And how can it bring peace, comfort, and dignity at one of life's most challenging moments? Joining us today is a representative from Hospice of New York, Steve Arons. He's here to help us to better understand the real purpose of hospice and how families can access support when they need it the most. Welcome, Steve. I'm so happy to have you on our show today.
Thank you for having me.
Yes, I think it's an important subject to start to talk about because I think there's a lot of unknowns when it comes to hospice. So having this conversation, I think, is really going to help enlighten a lot of people so they're not so scared of entering in or maybe having that conversation with their family members about hospice. So first, I'd like to start off by talking about New York hospice care. What kind of areas do you service? And just tell me a little bit about your hospice organization.
Hospice of New York, we cover the 5 boroughs in Nassau County. We have been around for about 29 years. So,
okay. And what would you say the philosophy of your organization is?
The philosophy of our organization is being able to help families and being able to help the patient, but mostly being able to help that family, especially after the inevitable does happen.
So hospice, I always feel like people that enter into hospice as a career path, it's a calling for them. You know, not everybody can handle end of life, and not everybody can handle, the conversations that come with that. So what made you go into hospice?
What made me go into hospice, honestly, is being able to help families. I learned at an early age that you want to be able to help the elderly population. My parents ran their own business. My father ran public trade shows throughout the Northeast United States. So he ran a custom car show in Asbury Park, New Jersey, in which on Saturday mornings and Sunday mornings before the event opened, he would allow assisted living communities and nursing homes to bring patients in to view the cars. Oh, so nice. At an early age, I realized that I wanted to be able to respect the older generation. But for myself, I've spent my whole career in the healthcare industry. For myself, 4 years ago, I was diagnosed with colon cancer. I am a survivor of colon cancer, but I had a unique support system. At the time, I was the director of sales at a Bristol assisted living, and from the residents that at the Bristol, who I had built a bond and a relationship with, because I considered these people my coworkers. These people basically helped me to get through that challenge. And I realized after that I wanted to be able to help families, to help them to give back to society and be able to help families to navigate through that process. For myself, my dad died at age 67 of acute leukemia. He was not a fan of hospice, but he did go on hospice. He did go on hospice services, and hospice services did help him. For my mother, she was 63 years old when my dad died. She lived another 30 years. Wow. And me and my 2 siblings basically helped her to manage through her life. She passed away 6 years ago, but I feel that there's a great need to be able to help families and geriatric patients. The biggest thing that families have to encounter when they're looking into hospice is there has to be there has to be a bond in which families have to work together to try and realize that mom, dad, or aunt or uncle need a service, and that you can't basically just, even one person might have the health proxy, but you have to be a cognitive unit and do it together. With hospice, it gives families an opportunity to bond, and it gives them an opportunity for that patient to be able to not only see loved ones and family members, but also friends, to be able to come in a dignified way and spend time with that person and salute that person.
You know, you're talking about the elderly coming on hospice, but hospice is open to any age group. Is there a criteria of age in order to go on hospice, or is it available to anybody?
Hospice, there is no criteria. It depends upon what the ailment is. You could have a 35-year-old woman, God forbid, that she has breast cancer. You could have a 35-year-old male that has colon cancer or has prostate cancer. So there is really no criteria to age. You hope that you're not placing somebody on hospice services of that age, but
It happens.
it does happen.
Right, but the main criteria is that a doctor has to still say that you have 6 months or less to live.
Correct.
And that's where it starts.
That is where it starts. What happens is when a referral comes into us, our medical team, our medical director will review the case. If he needs more chart notes, we will reach out to the physician, we'll reach out to a hospital to get CAT scans, MRIs, whatever that we need to make that determination if that person is eligible for hospice services.
They can't be on dialysis.
They can't be on dialysis if a family is not willing to want to give up treatment options, then they would not be able to go on hospice care. But what's unique about Hospice of New York is we offer a palliative care program.
Yeah.
And with our palliative care program, a patient would be able to stay on those services. And it's kind of like, for a family to really understand it, it's almost like a camp program, getting your feet wet, that we have our medical staff or a nurse practitioner that will check on that patient every 2 to 3 weeks to see how they're doing with their decline, and then have that conversation with the family members that the treatment might not be working, but it gives a family an opportunity to experience not what hospice is, but experience what a palliative program is, and then they would be able to graduate to a hospice program.
So the services that are different between hospice and palliative care is what?
Basically, on a palliative program, they're able to continue with all forms of treatment.
So chemo,
dialysis,
feeding tubes,
physical therapy,
okay.
occupational therapy, speech therapy, things of that nature. Yes.
So they kind of, and does that ever end? So like if someone is on Medicare services, because this comes up in our office a lot, if someone's on Medicare services receiving physical therapy, occupational therapy, maybe a nurse, and they want to go on palliative care, they would have to give up that service that they're having under a certified agency and move over to hospice palliative care?
No, it's all billed. Palliative is all billed under Part B of.
Oh, it's Part B. Okay,
yes.
so they can keep what they have.
It has no correlation.
What about hospice? Is that A or B?
Hospice is A.
A. So okay, so they could ideally could they have both?
You can't have palliative and hospice at the same time.
So let's talk about hospice, the services that hospice provides. So if someone's coming on hospice services, what can a family expect to receive? Hospice
services, you're going to receive a nurse to come visit, depending upon how many times a week our medical staff feels a nurse needs to come out. If it's somebody that has wound care, a nurse will be coming to do that wound care on a daily basis. You will also get a home aide that will come up to 4 hours a day.
I think I just wanted to talk about that because I think what was interesting is that you were saying that New York Hospice had all the home care aides are employees of.
Yes,
you're not outsourcing them.
We do not outsource. We do not outsource.
I think that's an important thing for people to know.
We do not outsource any of our employees. They are all employees of Hospice of New York. So other things that you will get is you'll get the home aide, you'll get get a social worker, you will get pet therapy, you will get music therapy, you will get clergy therapy. Those are all things that a family can make a decision if they want those. If they want those services, as well as volunteers that will come and brighten up that patient or that family, play board games with them, or do puzzles, or read them the New York Times.
So as far as the aid goes, because I know that most people, that's their focus. You know, people want to know if there's an aid, what they're entitled to as far as aid services. Although everything, all the other disciplines are very important, I know most people are focused on what kind of care they're going to receive as far as aids. So your hospice provides standardly, I'm talking about now, up to 20 hours a week.
Correct.
So what is the criteria? Do they have to meet a certain level of need before they get the 3 to 4 hours a day? And is that discussed prior to coming on so people know what to expect?
It's discussed prior during the admissions process, that our nurse, when they do the admission, will go over with the family how many hours of aid service they're going to get, how often they're going to see a nurse, and they'll come up with a treatment plan.
And what if they need more hours than the 4?
If they need more hours than the 4, I mean, families sometimes will go to an agency, or they'll pull together resources to get a family member to chip in to take care of those 8 hours, or they find some other alternative to help that family member.
Okay. So, and most of hospice is provided within the person's home setting, whether it's assisted living or in their own home. But is there a way, if someone is uncomfortable, because not everybody's comfortable with someone passing in their homes or being there when someone passes, so sometimes people opt to go to a facility. Is that something that New York Hospice provides?
Yes, we have quite a few contracted nursing homes in the 5 boroughs in Nassau County, in which we have patients that do their hospice stay.
Care there. And is there a length of time that they can stay there, or is it unlimited?
It's unlimited.
And families can opt for that in the beginning, or is that something that as care needs progress, that's when they choose to go?
They can opt for that at the beginning if they feel that they don't have the stomach or they don't have the manpower to be able to handle that family member at home. I mean, it's an option that they do have.
We're going to take a short break. We'll be right back with Senior Care Matters.
Body by Peter offers a premier at-home concierge service specializing in empathetic lymphatic massage and blood circulation enhancement. We provide a range of therapies, including red light therapy, wood therapy, body sculpting, and lymphatic detoxification. Our professional and compassionate approach ensures a rejuvenating experience in the comfort of clients' homes. Servicing Manhattan, Queens, and Long Island, New York. Call today, 516-509-3825. Every day, home health aides travel miles across our city to care for seniors who depend on them. But too often, long commutes and poor transportation keep them from reaching those who need the most. At All Things Home Care, we're changing that. By providing subsidized rides, we take the burden off caregivers so they can focus on care, not the commute. Because when caregivers are treated with dignity and respect, our seniors stay safe, cared for, and never alone. Join us in supporting the people who care for our loved ones. Learn more at allthingshomecare.org. We all say, today is the day that we tackle the organization of our homes. The day gets further and further away, but the job never gets smaller. We can take the headache out of planning and doing. We start with a free consultation, create an action plan, and bring you the space and peace of mind you need. We help with home decluttering and organization. Restore your home to a place of comfort. Call today, 516-322-2613. At Reliance Home Senior Services, we believe every day shines brighter at home. As a licensed New York State-based agency owned and operated by a registered nurse, Reliance brings over 20 years of experience and personalized care right to your door. Our certified personal care and home health aides assist with bathing, grooming, dressing, medication reminders, light exercise routines, and to accompany you to appointments, all while offering companionship and a safe, caring presence. Need help navigating Medicaid? We're here for you. Our team of registered nurses and social workers offers in-home geriatric management, so both you and your family can breathe easier. And with 24/7 on-call support, bonded and insured aides, and a custom plan of care crafted just for you, we bring peace of mind right into your living room. Reliance Home Senior Services, bringing comfort, independence, and trust home.
Welcome back to Senior Care Matters. We're here today with Steve Arons from Hospice of New York. We're discussing different hospice options for families in palliative care. So I just want to go back because you mentioned something that I think is, to me was important. So when someone is receiving hospice services, there's a lot of different services that they might receive within the home. One being a registered nurse, social work. You have a doctor that visits them, or is this a virtual visit?
No, we have a doctor that will visit them,
Okay.
yes, or a nurse practitioner that will visit.
Okay.
visit
And they're
them.
prescribing their medications and
Yes.
things like that. And do they have to give up their regular doctor?
Some do, some don't. Our medical team will consult with doctors if a patient wants to continue with their doctors, which is a big thing in the assisted living communities. So it's a collaborative effort in which our staff will reach out to the medical provider that goes to an assisted living, just to give them a heads up. I mean, a lot of geriatric doctors, they build a relationship with a patient over time, and they would like to be able to know what's going on. That's
They want to stay connected.
exactly.
And so the other thing is, does hospice pay for all the equipment and everything in the house? So like if they need a hospital bed, if they need incontinency supplies, is that all covered through the hospice?
That's all covered through their insurance, yes.
So you also talk about friendly visitors, which I think is, it's important. And you have a whole, I guess, a division of hospice volunteers that come and work with you guys. So if someone is listening, if they want to volunteer, where they check your website? How do they get in touch with that?
If somebody wanted to get involved in volunteering, they would reach out to our director of volunteering, Anthony, and they can go right on our website. And right on our website, there is a way to reach out to them. That's an important thing. A lot of our volunteers are family members that had loved ones in hospice service.
Yeah, and it's a healing process for them.
It certainly is a healing process. We offer a bereavement group that most people do take advantage of, whether it's the children, whether it's a niece or nephew or a grandchild. But they do take advantage of that service.
And it's important, that they maintain, that release of their emotions, that they're talking about it. I think that a lot of families don't access. Maybe I'm wrong, but that they don't access the bereavement, but they probably should. And the social. I know that because we deal with it a lot in our office, that we know that the social workers do call the families and they do follow up with letters and information, and really encouraging people to take advantage of that. And it's a free service, I assume.
It's a free service, and really it's an important thing because you don't want somebody to bottle up their emotions and their feelings, because it can affect them later on in life if they don't come up with a coping mechanism to be able to realize that person is better off, that they're out of their misery, that they're not suffering.
Yeah. Well, I think no one's really ready for that day.
No, nobody is.
Yeah. So I think that one of the things that people would probably I know I couldn't talk to my mother-in-law about, going on hospice. She would never, because she would always just assume that's it. As soon as I say yes, that I'm dying. So I think that's one of the things that people have to get, past, is that hospice is there to give support systems. It's not really just that you're going to pass away, like you said, tomorrow. It's a really supportive type of program.
No, it's a support. Hospice is a support system. So you want to be able to reassure the family that you're going to do whatever you can to be able to help that patient and that family get through their situation.
Yeah, and you said before that that there's some type of spiritual or religious involvement if they want.
We offer all different denominations of religious guidance to a family, whatever their.
And they go to the home as well?
They will go to the home, yes.
And they go anywhere? They
will go anywhere. Some of our clergy will actually perform services if a family asks.
So I think the other thing that comes up a lot is, sometimes, not all the time, but sometimes when someone is on hospice and they're suffering from cancer or some other type of disease or situation that causes pain, there's pain medication that's involved at times. And so how does the nurse help manage pain when someone's on hospice, and what kind of involvement does the nurse have? Because I know, if someone's in bed a lot, let's just say, or and they start to developing wounds, and then there's other wound care that goes on. That's something that hospice provides?
Yes, I mean, our nurses will reach out to our medical MDs, and they will prescribe different medications. They will do an assessment of the wounds and of debridement, and whatever is covered under the guidelines as far as wound care treatment, they will provide those.
They do the
things.
treatment.
They will do the treatment. If somebody needs diapers, that is provided.
Is provided, because the aides can't do the aides in the home.
No.
Cannot. So the hospice aides cannot give the medicine.
No, they cannot. And then
They can't do the wound care.
No, our nurses do the wound care, or we will train a family member to be able to know how to change that dressing.
If the family's available.
Right.
But if they're not, the nurse goes.
Correct.
Okay. And hospice, I'm assuming, is 24 hours a day, so you guys are available to families?
We are available 24 hours a day. I mean, we have nurses that will go out in the middle of the night to see a family. We can do an admission. 24 hours a day. So
Oh, I didn't know that. Okay.
hospice never sleeps.
Yeah, home care never sleeps. So if someone wants to contact you and get on, start the process of enrolling into hospice, what is their first step? Their first step is to call you or to call their doctor?
Their first step would be if they feel that their loved one is ready for hospice, they can go right on our website, or they can call Hospice of New York, and one of our liaisons or one of our business development people will get in contact with that family, and then we will start the process of getting whatever paperwork that we might need, medical charts and things like that, so our medical director can make a diagnosis of what the criteria is for that individual and that patient.
Okay, and it can be done whether they're if someone's in a hospital, if someone's during a subacute stay. It doesn't necessarily mean that they have to be in their home or in an assisted living.
No, it can be done in a hospital. The assessment, it can be done in assisted living, it can be done in a nursing home, it can be done in somebody's home.
Okay.
So it's just a question of when a family realizes that it's time. As we approach the holiday season, a lot of families get together with family members, and it's a good opportunity to test that relative to see what's going on with that relative. And that's an opportunity to see if maybe they've declined. So it's.
Yeah, but I just want to, I don't want people thinking that everybody qualifies for hospice.
No,
'cause that's
not everybody.
the case. And it doesn't mean just because they're declining that they're going to qualify.
No, not everybody.
They have to be at the end of stage of life. It's not just like you. Yeah,
they have to be at the end stage of life. And unfortunately, a family member can't say, "Ooh, let's put mom, dad, aunt, or uncle on hospice." They have to meet medical criteria of 6 months or less to live.
Because I know we have had families call, and sometimes they think that going on hospice is a way to get an aid. And that they're getting an aid for 4 hours a day through hospice that they can't get through traditional Medicare services. So they'll call us up and they'll be, I need an aid for 4 hours a day, so let me go on hospice. But that's not what hospice is for.
No, that's not what hospice is all about.
People listening, that's not what hospice is for.
That's not the premises of hospice, no.
But they do think that. So we're educating them. I think this is an education for people as well. It's definitely a service that is useful for families. It is a service that is there for families, but it's not if you just need a home health aide and you.
No.
Okay. Yes. Let's make that very clear. So, and also, one of the things that we were talking about before that I actually did find very interesting, because you're bringing up one of the challenges in home care that I think everybody has, and I don't think anybody has figured out how to master it, is staffing. and availability of home care workers to get them to these people. So, one of the things that we fight for very hard is for transportation for home care workers, because if someone is in need of care, whether it be skilled care, a regular Medicaid care in the home, or, hospice, they've lived their whole life and now they're coming to the end of their life. They are on hospice and they're entitled to the services, the aid services. The family wants that support, but yet an aide can't get to them because there's no aides available in the location where they live. And one of the things that you had said, which I find very, I like it a lot, is that you help get them there.
Yes, that is an important thing that Hospice of New York has stressed from the beginning, that we will, there's a will, there's a way, we will get an aide there. So if it means us putting that aide in a Uber or a Lyft or a taxi to get them to point A to point B, we will do it, because that family is in crisis and that family needs somebody, and you want that aide to show up. You don't want them not to show up.
You need that aide to show up. And I think that's one of the things that people don't understand, is that a lot of these workers, it's not that they don't want to work, it's that they don't have the availability of getting there. And that, to me, is a tragedy. We fight for it all the time. So I'm very impressed with the fact that you guys actually acknowledge that, you see that as a barrier, and you assist them to get there. So I say, good for you.
No, it's an important thing, because, not everybody's on that bus route. Not everybody's on that train route.
90% of them are not on that bus route. Steve, I want to thank you so much for coming and spending some time with me today. I think that people, all the questions that they may have had about hospice, I know the questions that we get in our office about hospice, I think we definitely shed some clarity on that. You definitely gave some useful information, and I just, appreciate your time. And if anybody wants to get in touch with you, or if they, want to enroll, or they have questions about enrolling, or, they have a question to ask their doctor, how would they get in touch with you?
They would reach out to us, Hospice of New York, and we would be more than happy to answer any questions that any family member has regarding the process of hospice. Remember, we're there for the family, and you should always ask a family member or somebody that you care about, how is your health? Because you want to be able to help. You want to be able to help people. That's the important thing.
Well, I think when you lead with that, you're in your purpose. So I can't, there's nothing more to say about that, but I do thank you. Thank you for watching Senior Care Matters. I'm Dana Arnone, and we'll see you next time.